Hey there, if you're getting ready for what's called a hysterosalpingography, or let's be real, an HSG test, you are in exactly the right place. We're going to walk through everything you need to know from beginning to end, so you feel totally ready.
So your doctor recommended an HSG test, and it is completely normal to have a bunch of questions buzzing around in your head. Our whole goal here is to walk you through it together so you know exactly what's coming and can feel confident on the day of your test.
Okay, so what in the world is an HSG test? Well, at its heart, it's a special kind of X-ray. It gives your doctor a really clear look at your uterus and fallopian tubes by using a contrast dye. Think of it like a little roadmap that shows exactly what's going on inside.
But why this test? Why is it such a crucial piece of the puzzle when you're looking into fertility? Let's get into it.
This test is actually looking for a few really important things. Number one is checking for blocked fallopian tubes. That's a big one because that's where the egg and sperm need to meet. But it also gives us a great view of the uterus itself, helping to spot things like fibroids, polyps, or scar tissue. And it lets us see the overall shape, which is super helpful info before starting treatments like IUI or IVF.
All right, let's talk prep. Knowing what to do beforehand can make a huge difference. And the best part is it's all really straightforward. So let's break down how to get ready.
You know, timing is everything with this test. Your doctor is going to be pretty specific about when to schedule it. The sweet spot is right after your period ends, but before you ovulate, which is usually somewhere between day 7 and day 10 of your cycle. This is just to make absolutely sure you're not in the super early stages of pregnancy.
On the actual day of the test, prep is pretty simple. It's a good idea to take an over-the-counter pain reliever like ibuprofen a few hours before, just to help with any potential cramping. Feel free to have a light meal, and you know what? It never hurts to have a friend or partner come with you for support. On the don't side, just avoid things like tampons or intercourse for about a day beforehand.
Now, this is really important. Your safety is, without a doubt, the top priority. So you absolutely have to let your doctor know if there's any chance you could be pregnant, if you have an active pelvic infection, or, and this is a big one, if you've ever had an allergy to the kind of contrast dye used in x-rays. It's all about making sure this is the right and safe procedure for you.
Okay, let's pull back the curtain and talk about what actually happens in the room. I know the unknown can be a little nerve-wracking, so we're going to go through it step by step. And just remember, for your medical team, this is a very routine, quick procedure they do all the time.
Probably the first question on your mind is how long is this going to take? And you might be surprised to hear the whole thing is usually done in just 10 to 15 minutes. That's it.
So here's the play-by-play. You'll get settled on a table just like for a regular pelvic exam. They'll insert a speculum, and then a tiny, super thin, flexible tube called a catheter is gently put in place. Next comes the contrast dye, which is slowly introduced. As that dye makes its way through, the radiologist will take a few x-ray pictures, and once they've got the images they need, the catheter comes out, and you're all done.
Okay, let's talk about the elephant in the room. Does it hurt? Look, it's really common to feel some cramping when the dye goes in, kind of like period cramps. For most women, it's a mild pressure that lasts for just a few moments. It's a temporary feeling that usually goes away as soon as the test is over. And just like that, the procedure is done. So what's next? Well, the great news is that recovery is really fast. Most people are right back to their normal activities by the very next day.
It's really helpful to know what to expect afterwards. Some mild cramping and a bit of spotting for a day or so, totally normal. But you should definitely call your doctor if you have any severe pain that doesn't let up, heavy bleeding, a fever, or any unusual discharge. Those are the signs you need to reach out.
To help things go smoothly and lower any small risk of infection, there are just a few easy things to keep in mind. Stick to pads instead of tampons, and it's a good idea to hold off on intercourse and swimming for about 24 hours. Really, the main thing is to just give your body a little bit of time to rest and reset.
All right, you've done the test, you've rested up, now for the results. A specialist reviews the images, and then your doctor will go over them with you. So what do these pictures actually mean for your journey?
It really all comes down to watching where that dye goes. Think of it like a plumbing check. If the dye flows right through the uterus and spills out the ends of both fallopian tubes, that's great news. It means the pathways are open. If the dye gets stuck or stops somewhere, it might signal that there's a blockage that needs a closer look. The best part is that these results aren't just information. They're a roadmap. They tell you and your doctor what the best next step might be. For example, if there's a blockage, sometimes a minor surgery can fix it. If everything looks good and open, it might mean you're ready to move forward with treatments like IUI or IVF. It's all about creating a clear plan.
So it's really important to remember that the HSG test isn't the finish line.
It's a key step, a really valuable piece of the puzzle. What it does is give you and your medical team powerful information so you can make the absolute best, most informed decisions about what comes next for you.